adrenaline and its properties. Here are the statements and their answers. A non-selective beta receptor agonist. True. Adrenaline is a stimulant of both alpha and beta receptors, making it a non-selective beta receptor agonist. B. A physiological antagonist of histamine. True. Adrenaline has opposing effects to histamine, a substance involved in allergic reactions. Adrenaline can counteract the effects of histamine, such as bronchoconstriction and vasodilation. C. A light-sensitive substance. True. Adrenaline can be degraded by light, so it is often stored in dark containers. D. Administered immediately intramuscular in anaphylactic shock. True. Adrenaline is the first-line treatment for anaphylactic shock and is administered intramuscularly to quickly counteract the severe allergic reaction. E. Usually available as 1 in 10,000 concentration. False. Adrenaline is typically available in a much higher concentration, such as 1 in 1,000 or 1 in 100, for immediate administration in emergency situations. In summary, adrenaline is a non-selective beta receptor agonist, a physiological antagonist of histamine, a light-sensitive substance, administered intramuscularly in anaphylactic shock, and usually available in a higher concentration than 1 in 10,000. Adrenaline, a powerful hormone and drug. Adrenaline, also known as epinephrine, is a hormone produced by the adrenal glands. It plays a crucial role in the body's fight-or-flight response, preparing the body for a stressful situation. It is discussing the actions of adrenaline on the blood vessels and the heart. Vessels. Adrenaline primarily acts on the smaller blood vessels called arterioles. It stimulates alpha receptors in the arterioles, causing vasoconstriction. This means the blood vessels narrow, leading to increased peripheral resistance, PR. As a result, the skin and mucous membranes decreases. However, adrenaline also increases blood flow to skeletal muscles by stimulating beta-2 receptors. Heart. Adrenaline is a powerful cardiac stimulant. It acts on beta-1 receptors in the myocardium, pacemaker cells, and conducting tissue of heart. This stimulation increases the force of contraction, positive inotropic effect, and increases the heart rate, positive chronotropic effect. As a result, cardiac output and oxygen consumption are also increased. In summary, adrenaline has both vasoconstrictive and vasodilatory effects on blood vessels, depending on the specific receptors involved. It also has a strong stimulating effect on the heart, increasing its contractility and heart rate. Actions of adrenaline. Blood pressure. Vasopressor. Adrenaline raises both systolic and diastolic blood pressure. Cardiac output. This increase is primarily due to an increase in heart rate. Stroke volume. While adrenaline can slightly increase stroke volume, its primary effect on heart rate. Respiratory tract. Bronchodilator. Adrenaline relaxes bronchial smooth muscle, making it easier to breathe. Antagonist to bronchoconstrictors. It opposes the effects of substances like histamine that can cause airway narrowing. Pharmacokinetics of adrenaline. Availability. Injectable preparation. Adrenaline is typically available as a 1 to 1,000 solution, 1 mg per milliliter, for injection. Administration and absorption. Intramuscular, IM, injection. This method provides the fastest onset of action and has a higher safety margin. Injection site. The middle of the lateral thigh is preferred for IM injection, as it leads to the quickest peak blood concentration. Subcutaneous or deltoid injection. While possible, these sites result in slower absorption and peak blood levels. Storage. Refrigeration. Adrenaline should be stored at a temperature below 25 degrees Celsius, preferably in the refrigerator, to maintain its potency. Light protection. It should be protected from light to prevent degradation. Color and precipitate. Adrenaline should not be used if it has a pinkish or darker color or if it contains a precipitate. In summary, adrenaline is a potent hormone that plays a vital role in the body's stress response. Its effects on blood pressure and respiratory function are particularly important in medical emergencies. Proper administration and storage are essential for ensuring its effectiveness and safety. Adverse effects of adrenaline. Adrenaline, while a powerful and life-saving drug in certain situations, can also have significant side effects. These effects can range from mild to severe, depending on the dose and individual sensitivity. Common adverse effects. Anxiety and restlessness. Adrenaline can induce feelings of anxiety and unease. Dyspnea. Difficulty breathing or shortness of breath. Palpitations. A feeling of your heart racing or pounding. Tachycardia. A rapid heart rate. Anginal pain, chest pain that can be a sign of heart problems. Tremor, shaking or trembling. Weakness, feeling physically weak. Dizziness, feeling lightheaded or dizzy. Headache, a headache. Cold extremities, hands and feet may feel cold. Hyperglycemia, increased blood sugar levels, even at low doses. Serious adverse effects. Ventricular fibrillation, a serious heart rhythm disorder that can be fatal. Severe hypertension, extremely high blood pressure that can lead to cerebral hemorrhage, bleeding in the brain. Pulmonary edema, fluid buildup in the lungs. Adrenaline in anaphylactic shock. Essential treatment. Adrenaline is considered the most important drug for treating anaphylactic shock, a severe allergic reaction. Timely administration. Delays in administering adrenaline can significantly increase the risk of death in patients with anaphylactic shock. Recommended dose. For adults, the recommended intramuscular dose is 0.3 to 0.5 milligrams, 0.3 to 0.5 milliliters of a 1 to 1000 solution, injected into the middle of the lateral thigh. Intravenous administration. IV adrenaline should only be administered by a trained physician in a setting with monitoring capabilities, as it can cause serious heart rhythm problems.